Today, lifestyle is a huge component adding to the problems of fertility. Smoking, alcohol, junk food, processed food.
Pollution, approximately smoking 17 cigarettes every single day.
I can't change the pollution, but I can change my weight. Thalassemia is the most common genetic disorder in our country. When couples get married, सबसे पहले वो जन्मपत्री मिलाते हैं. Of course, you need to match yourself astrologically, but you also need to match yourself genetically.
So when would it be the right time for somebody to start taking antioxidants?
So I don't think there's any right time to start supplements because everyone is being affected by the negativity of nature and
Okay, let's go. Setup done? All good? ठीक है, पापा आ रहे हैं बस. I think he's almost on his way.
2,000 years later.
माइक वाइक सब टेस्टिंग हो गया ना? ठीक से?
Hi Sahil.
Hello.
Hello everyone. Okay, let's roll.
Very excited for the first podcast of Dame Health. Actually, the wellness show by Dame Health. So, आपको पापा बुलाना है कि डॉक्टर राजीव बुलाना है पॉडकास्ट में?
Good question. I think Dr. Rajeev will look more professional.
थोड़ा प्रोफेशनल ज़्यादा लगेगा
तो
actually.
वो लोग इज्जत नहीं देंगे if you call me Papa in the podcast.
ठीक है, done. I think in this podcast specifically, we want to dive more deep into fertility, the reason why preconception multivitamins are important. So let's go through that. I think there's a lot of good information we can give out. So
ठीक है.
let's go.
Best of luck for your first podcast.
Thank you.
Let's do it.
Hello, Dr. Rajeev. Welcome to the Wellness Show podcast.
Thank you, Sahil, for having me here.
This is our first episode, so we couldn't think of a better person to join us than you. So the main aim of the podcast is to dive into some of the most complex topics regarding women's health, which a lot of people are very confused about. And I think just to start with the podcast with, one of the first topics which you would like to discuss is infertility, something which I feel that there are a lot of people dealing with it right now, and there's not a very good definition which people have of what it means. So can you start with that, please?
So the word infertility itself is something that we try not to use now because it's demeaning. So rather than use the word infertility, we use the word subfertility, where infertility means you can't conceive. Subfertility means that your fertility is lower than maybe another
Ideal.
person. What is ideal? The definition of subfertility would be, say, a couple who's been having unprotected intercourse for some time and not being able to conceive. Now, what is that some time? If that couple is less than 35 years of age, then age is on their side, so they could probably try for a year. And if they are still not able to conceive, then we say they could be subfertile. However, if the couple is above the age of 35, especially if the woman is above the age of 35, then this 1 year gets compressed to 6 months because time is running out.
Got it. So I don't know if infertility was this big of an issue or a topic which people used to discuss earlier, but now a lot of people discuss it. So was this issue the same 20-25 years ago?
I think the issue was the same. Now it's very difficult to exactly define, has the problem become bigger or the awareness or the investigation of it become bigger? There is no doubt that a lot of things have changed in our lives. The pollution has become more. The pesticides in the food has become more. The forever chemicals in our lives have become more. The stress has become more. Lifestyle problems have become more. So possibly fertility issues have also become far much more
Because of that.
but I don't think it's going to be possible to give an exact count because there was no awareness regarding these problems. The treatments weren't that good as they are today. So probably that is also something that has added to identifying the problem.
Got it. So you mentioned a very interesting point, which is the lifestyle problems. I'll come to that, but just before that, have the type of problems changed in the past 20 years? Like, did people come with a different problem because of which the infertility happened, or is the same problem just magnified?
I definitely think the kind of problems that we dealt with or we thought were important earlier have changed. So on a broad basis, what is it that is required to have a pregnancy? You need sperms, you need eggs, you need a healthy and open fallopian tube, and you need some hormones from the female side. Now, when we earlier spoke of subfertility issues, fallopian tube blockage, infection, those were really topmost on our minds, that 40% of the problems could happen. I definitely think the context and the problems of how we looked at subfertility maybe 20, 30 years ago and how we look at it today has changed. So on a broad basis, there are 3 things or 4 things which are required to have a baby. Eggs, sperms, an open and healthy fallopian tube, and some normal hormones. So when we were looking at this problem earlier, we would talk about maybe because of infection, the fallopian tubes have changed, or maybe the sperm count has gone down for a variety of reasons. Or if we considered egg problems, we would consider them in a woman above the age of 35. Today, especially post-COVID, majority of the women that come to me are coming to me with a poor ovarian reserve. I feel the egg quality, the egg numbers have gone down dramatically. For men as well, the WHO, which is the governing body across the world, which talks about what is normal, what is not normal as far as sperms are concerned, has been forced to reduce what is normal by more than 50%.
In terms of quality?
In terms of quantity, in terms of quality of sperms.
Okay.
So because if they still went by their early definition, probably all the men would be infertile. So that itself, I think the perspective of the problems has changed. I don't know if my forefathers were really looking at lifestyle as a problem. But today, lifestyle is a huge component adding to the problems of subfertility.
So what type of lifestyle factors can affect fertility?
So there are various aspects to lifestyle problems. Of course, we know that India is now fast becoming the obesity or the diabetes capital of the world. So weight itself adds to subfertility both for men as well as for women. Stress levels have increased. We know that when stress levels happen or they go up, cortisol levels tend to go up and the fertility issues become a bit of a problem. Smoking, I think, has become far more common both in men and women than it used to be at an earlier time. Then the problem of alcohol has become much more. I don't think anyone had shisha, hookah in those times, but today more and more youngsters are abusing these kind of things. And definitely vaping wasn't around at that point in time. So I think all these issues put together, junk food, processed food, was obviously unheard of 20, 30 years ago. So that junk food now coming in, the processed food coming in, the kind of chemicals and hormones that we are pumping into our bodies is all adding to somewhere disrupting the natural processes and adding to the subfertility.
Got it. So I think the one thing which is a little difficult for a layman to wrap around is that usually when people think of fertility, something related to the egg or the sperm primarily. How does weight or how does smoking, for example, smoking affects my lungs is something which I can understand. But how does it affect my sperms? What's the relation between the two?
That's a very good question. So how does stress cause someone to have a heart attack? So whenever you have these negative things around you, as you very rightly said, pollution or stress or obesity or these things, of course, some of them may have a direct relation. For example, obesity does have a direct correlation with women not ovulating very well or the egg quality being not very good. But a lot of these other sort of indirect factors increase certain free oxygen radicals in our body.
Okay.
Or these indirectly would then work on different processes in our body and negatively affect them. So these are kind of sort of these harmful signals that are going around all over the body and disrupting all the processes which are happening in our body. That's the most simplified way I could probably put it.
So I think again, weight gain, smoking, vaping, all of these trigger so many different signals, and with multiple things happening at the same time, I think your body is going into a complete havoc.
Absolutely, yes.
Got it.
Yeah.
Okay. And so with infertility specifically, or subfertility as we might call it, do you see a trend in terms of this being more of a tier 2, tier 3 town or village issue, where again, in terms of food being of subpar quality, or the kind of lifestyle which people lead will also be little lesser compared to in tier 1 cities where people seem to have a better lifestyle?
I think that divide is becoming more and more blurry now, because certain areas will have more opportunities available to them, the availability of a doctor, then the awareness is more, so the reach to a doctor is more, so probably you will get investigated more, get treated better. Again, we would earlier think that processed food is something that you find in the cities. Bad lifestyle is what you find in the cities. But today we know there is no such divide between, the cities and the districts and the villages. It's percolated everywhere. So the problems have also now percolated everywhere. Probably the people in the villages or people with poor socioeconomic conditions find it even more difficult because they don't find good doctors there. And financially also they get compromised. So their problems only get compounded because of that. But it's not that someone in the districts doesn't have fast food.
So I think it's just the problems are there. It's a different set of problems for different set of people, but problem nonetheless for fertility. Got it. So you mentioned lifestyle factors affecting fertility. You mentioned some factors which seem to be in our control, like for example, weight gain, smoking, drinking, but you also mentioned pollution, which is something which doesn't seem to be in our control, especially for people in cities like Delhi, Bombay. The pollution level is just so high. I read in a report that it's approximately smoking 17 cigarettes every single day. In that case, what do you do to save your fertility?
So it's not that you leave it to God and fate to decide how your fertility is going to change because of pollution. What I would do probably in that situation is, maybe if my weight is on the higher side, I can't change the pollution, but I can change my weight. So some of the negativity could be offset by changing the things that I can. So whether it's reducing my stress levels, exercising, eating healthy food, and so on and so forth. And then again, for the pollution, what I could do is use a lot of antioxidants. If I pump my system, and I understand in one of the questions that we discussed a little while back about the reactive oxygen species, the free oxygen radicals in the body. What do you do for them? You pump yourself with a lot of antioxidants, and these antioxidants will counter the negative effect of those free oxygen radicals. Thus, you could probably cleanse your system of these negative things, pollution for one, and improve your fertility.
Okay. So, would it be right to say that an antioxidant is more like a detox for your body?
Absolutely, that is what it is. So detox is happening through your meditation, through your exercise, through your food, and everything else that you're doing to kind of cleanse your body. But whatever it can't do, the antioxidants are doing it for you.
Okay. And where do you find these antioxidants?
So some of these antioxidants are of course available in your diet, but it's easier said than done. Sometimes you only get that much in your food, and the food itself also has to be good. I mean, you would really have to take organic food from a farm. 20 years ago, it was normal to have farm food. Today, it's a luxury, and we call it organic food, which has become so expensive that you can't have it on a daily basis. So where do you get these antioxidants from? Probably in today's day and age, getting it from supplements is the best way to do it.
So you mentioned a very nice point here, actually, that the concept of farm to table is something which has really very recently come on board. But we always look for food which gives us some sort of benefit. For example, with orange, vitamin C, and sometimes we actually go out of our way to have something because we feel it will give us a benefit. But since again in today's world there's so much of depletion of the nutrients, that's why I believe supplement would really work here. So you mentioned antioxidant supplements for somebody who's facing with fertility issues. What type of supplements would you recommend to them?
So supplements or antioxidants can start with as basic as vitamin C. Vitamin D itself is fantastic, and if your vitamin D levels are on the lower side, it's been shown, enough research papers are there that your fertility starts to decrease. Beyond that, omega-3 is very, very good. But I think one of the most powerful antioxidants in the world is coenzyme Q10 or ubiquinol. It's both anti-aging and something that improves your fertility. For women with PCOS, I think resveratrol is absolutely brilliant in trying to manage the hormonal shifts of PCOS.
Got it. So, supposing there's a couple who's in their late 20s or early 30s, is that the right time for somebody to start an antioxidant?
I think antioxidants are something that one should be starting whenever they feel it's right for them. You know, as they say, jab jago tabhi savera, because it's not that pollution is not affecting an 18-year-old or a 20-year-old. Yes, their systems are far more robust at that time to be able to fight the menace of the problems. But if you ask me one time, then probably yes, late 20s is when your immunity probably also starts to go down.
It needs
your
it the
defense
most.
systems start to become a little weak. And then probably adding these antioxidants would make more sense.
Got it. So when would it be the right time for somebody to start taking antioxidants? Is it somebody in the late 20s and early 30s?
So I don't think there's any right time to start supplements, because everyone is being affected by the negativity of nature and the man-made processes. But yes, maybe in your early 20s, your body, your systems are more equipped to fight the negativity. But probably if you ask me for one time, late 20s is a good time, because your defenses are now becoming slightly weak. And at this time, probably if you add the antioxidants, you could counter some of these problems.
Got it. So in terms of a fertility supplement, how effective is it? Is it good enough to sort of push the needle and help somebody conceive, or does it just give that minute added advantage to somebody?
So how do these fertility supplements help? Now, if today I were to have a deficiency of vitamins and minerals which are essential for fertility, then I am reducing my fertility when I have these deficiencies. But if I were to take a supplement, I would ensure that all my vitamin levels and mineral levels are at an optimum, and thus my fertility would get optimized. But that does not mean that if I have a particular problem, so say for example, I'm taking a B12, I'm taking a preconception vitamin, which has my daily requirement of B12 being met. But if I were to be severely deficient in B12, that supplement would not be able to make those corrective changes. I would then require to take a specific B12 supplement to be able to make up for that deficiency. But that preconception vitamin would ensure that otherwise my B12 levels and all my other vitamin and mineral levels are being kept at an optimum if I've been taking it regularly for quite some time. I think that is one major difference, what people need to understand. They probably expect that if you take a preconception vitamin, magic is going to happen and all your problems are going to get solved. That doesn't happen. But it ensures that problems because of further deficiencies do not happen if you take the preconception vitamin.
Got it. So I think it's more of prevention and preventive healthcare rather than cure based, something which I feel we all are not very used to. We're used to actually treating the problem once it happens. But you mentioned something called preconception multivitamins. Can you explain what it is exactly, and when should somebody start something like that?
So preconception is really the time, say 3 months before you actually conceive, in the period that you're thinking of conceiving, also called as the zero trimester. Why is this zero trimester so important? Because eggs and sperms both take about 3 months to mature. So if you were to, kind of have the healthiest environment being present for the eggs and the sperms, then you would probably have better quality eggs and sperms being available 3 months later to give you a healthy baby. Now, during this time, you're making your lifestyle better, your weight, your diet, your exercise, and all these things better. But at the same time, you also make sure that all your vitamins and mineral levels in your body are much better. In that, if all these preconception vitamins are taken, now what is a preconception vitamin? People think preconception vitamin only means folic acid. But folic acid is just one of the ingredients that are required for making better eggs and better sperms. Why is a vitamin D not important, or a vitamin C not important, or maybe other minerals, selenium, calcium not important? So preconception vitamin is really the essence of all these important vitamins and minerals put together into a capsule, making sure your daily requirements are met so that deficiencies don't happen.
So if a preconception multivitamin has so many things which actually helps people so much actually, then in that case, why haven't I heard most people using preconception multivitamins?
जो दिखता है वो बिकता है. Now, honestly, folic acid is, of course, the most important vitamin. It is something which is marketed, which is spoken about the most. And again, if you look at the West, you wouldn't have someone going to a store and buying folic acid. Everyone in the West would talk about preconception vitamin. Unfortunately, that hasn't percolated down to our conscious or subconscious in India. Everyone here still talks about folic acid because that is what we've been preached and taught. But what actually one should be taking instead of just taking a folic acid is a preconception vitamin. The change has happened in the West. The change will happen in the future in India as well.
Based on what you're saying, it seems that it's not just about preconception multivitamins and the awareness of it, but more also about the awareness of planning for pregnancy. A lot of people actually landed up at a gynecologist after they've realized that they conceive. So isn't that a problem?
Which is why I famously say, don't just conceive, preconceive. So it's very, very important that maybe after you get married itself, irrespective of whether you want to have a child at that time or you want to have it maybe 3 months, 6 months, 1 year or 2 years later, you should probably make a visit to your gynecologist or your fertility specialist, discuss your options, get your basic tests done, understand what could be the problems related to your fertility and general health, get them corrected, and then in a planned manner go forward. So that you probably don't hit road bumps and you definitely don't fall into a ditch.
Got it. So supposing someone who's just got married and they're planning to have a baby in the next 1 or 1.5 years, what are some of the steps that they can take to ensure that their fertility is in the right place?
So as I mentioned, there are 4 things important to have a baby: eggs, sperms, fallopian tube and hormones. At a very basic level, these 4 things could be tested to understand if their fertility is intact. Of course, the fallopian tube is tested by an invasive method. So probably no one in their right minds just after getting married, thinking of having a baby after 1.5 years, would want to get their fallopian tube tested. But then where does the fallopian tube go wrong? Infection. So infections may block the fallopian tube. There is a test for chlamydia trachomatis, which is the most common reason for the fallopian tube damage. We could test for the fallopian tube damage indirectly by testing for the chlamydia trachomatis infection, and that could tell you whether something more important, invasive for the fallopian tube testing is required at that point in time, or what is the possibility of you developing a damage of the fallopian tube by indirectly testing. So these basic testings could be done right after marriage or any point in time that the couple is thinking of having a child, then or much later.
Okay. So I think another thing which people would be concerned about is any sort of genetic abnormalities which somebody might have or their child might have later on. In that case, is there a test for that as well?
So I honestly am shouting from every treetop possible that when couples get married, obviously सबसे पहले वो जन्मपत्री मिलाते हैं, and साथ कितने 100-16 जितने भी ग्रह हैं उनके मिलने चाहिए, and we keep telling couples that of course you need to match yourself astrologically, but you also need to match yourself genetically. For example, thalassemia is the most common genetic disorder in our country, more common than you think you know it is. And I've even had a couple, they were dating for actually 10 years. They finally got married. And when they came in to have a child, they didn't realize that both of them were thalassemia minor, making it a 25% possibility of the child being thalassaemic major. And then they actually were required to go in for an IVF, make sure corrective therapy is done, and we managed to give them a healthy child. Imagine what could have happened if they actually conceived naturally, and if the child fell into that 25% category and landed up having thalassemia major. There are many other genetic such problems. We being a tertiary referral center for genetics, we get many such couples who've had their firstborn with deafness, blindness, Hodgkin's lymphoma, some cancers, and many other such genetic problems, which when investigated we found could have been easily avoided if such carrier screening genetic problems carrier screenings were done for these couples after their marriage and before they actually conceived naturally.
Wow, didn't know that. It's crazy. Okay, so we've spoken about preconception multivitamins, we've spoken about preconception counseling, and some of the genetic tests that people can do to ensure that their baby would be healthy. For people who try these fertility multivitamins, for people who've done the testing and still they're not able to conceive after maybe a specific timeline, what options do they have?
So I think at the very first consult itself, when we start to take a history, we try and identify what are the various problems that these couples may have. Then tailored investigations are done. When those reports come in, through the reports as well, we try and understand what specific problems these couples could have. For example, maybe a thyroid problem, a B12 deficiency, vitamin D deficiency, maybe the sugars could be on the higher side, the sperm quality could be poor, maybe the egg numbers are not very good. So we try and see how many of these we can rectify. From there, we put them into a series of treatments, which is in a graded fashion. So initially, we try and tell them what is the right time for them to stay together, maybe because most couples don't even know that. So recently, I had one couple. So the lady had PCOS, and because of PCOS, she was not ovulating very well. We put them through something called a follicular study to understand when is it that ovulation is occurring. Now understand, if ovulation happens say on the 25th day and the couple is being intimate on the 10th day, obviously the chances of fertility or fertilization and pregnancy would be on the lesser side. So this lady, when we put her through the paces, so normally ovulation would happen say on the 14th day. We waited till the 18th, no ovulation. 25th day, no ovulation. 35th day, no ovulation. 45th day, no ovulation. She ovulated on the 54th day of her cycle. We actually had the patience of doing these studies till the 54th day. Of course, it was her patience as well, her endurance as well, for coming in regularly for that many ultrasound tests. We managed to get an ovulation around that time. She did have, she was intimate with a partner at that time, and she actually conceived in the first cycle. So some of these things are corrected as we go along. So as I said, first we try and put them through the natural trying paces. Most of the people, I would say almost 20-30% of the people do conceive at this stage. If they don't manage to conceive, then we put them into the next treatment, which is IUI or intrauterine insemination, a very simple treatment in which we make the eggs better, we make the sperms better, we make the environment better, we get the timing right, and we put the best possible sperms in the best possible place, that is inside the uterine cavity. Pregnancy rates tend to jump maybe from the natural trying situation, maybe by 100%. So from there, again, we put them through maybe 1 cycle, 2 cycle, or 3 cycles of an IUI. If they don't conceive even at this stage, then we probably push them to an IVF, which is a much higher form of treatment. Some of the couples, when we do an initial investigation itself, we would realize that they are probably not fit for normal trying. They would go to the IUI stage itself. Some couples may jump to an IVF stage itself from the very beginning.
Got it. So when we reach to the IVF stage, in that case, is it possible to solve most of the problems that they do face in terms of their egg quality, sperm quality, fallopian tubes, and hormones?
I wouldn't say that IVF is able to give a child to everyone. But I think if one has the willpower, the endurance to go through all the IVF cycles, failures, and all the negativity which sometimes could be associated with the treatment, and of course you have to have the financial means to also pay for the treatment, because sometimes long drawn treatments can turn to be very expensive. Almost everyone is going to have a baby. I would say at least 90-95%. But you have to go that long way to be able to get that success. So basic IVF itself gives you about a 40% success per cycle. If I'm doing an embryo biopsy, that is more advanced treatments of IVF, then one would go up to almost 70%. Yes, there is a 30% gap. There is a very nice recent study which says that if you've transferred genetically tested embryos to a couple and you do that 5 times, 98% couples would get pregnant.
Okay.
That last 2% is what would require probably more intensive therapy or some kind of advanced treatments would be required for such couples.
Okay. So, for somebody who is very new to this space, in that case, treatments like IUI or IVF do, at least in the first instance, seem unnatural. So, in that case, is there any difference in the baby between a natural pregnancy and a baby coming via IVF or IUI?
IVF has been around for the last 50 years, and obviously you can understand tons of research has poured in. Every study says the same thing, that IVF babies are just like any other baby conceived naturally. There is no difference between them. Otherwise, you would have had multitude of such papers being available on the internet. In fact, over the last 5-7 years, if you look at research work, what latest research is showing that all the problems which may be encountered during pregnancy or if at all in the baby post an IVF are because of genetic problems in the couples who are subfertile. So by the very nature of having a fertility issues, they probably have certain genetic modifications which make them more susceptible to problems during pregnancy and to problems in their child. Now, if the same couple were to have those carrier screenings done and identify some unique problems which they are probably susceptible to and get them avoided during IVF, such complications also could probably become much lesser.
Okay. So that's very interesting. I'd like to jump back to something which you said previously, where you mentioned that there are 4 factors that can contribute towards fertility or subfertility: the eggs, the sperms, the fallopian tube, and the hormones. So, in terms of the sperms, how much does that contribute in the overall fertility outlook? And the question which leads is that how much do men contribute into the fertility outlook?
Now, men are 50% of the solution because you require both eggs and the sperms. So then they become 50% of the problem as well. And we know that many issues come from the men itself. Now, from the sperm perspective, I think the problems are only getting bigger because of all the reasons that we've discussed. There's no point getting into them again. But what people don't realize is, for example, you take miscarriages. Most people would blame women for the miscarriages. Or, you didn't eat well, you walked upstairs, you walked too fast, or you did something wrong, or maybe you were stressed. What we don't know, or what we are getting to realize now, is 30 to 40% of recurrent miscarriages are because of men. The sperm quality, the sperm looks on the analysis may be absolutely fine, but there is subtle DNA damage in the sperms which could be contributing to the recurrent miscarriages. Genetic problems in the child are again being contributed equally by men as it is from women. Surprisingly, I don't know how many of you know, everyone knows about women being nauseous during pregnancy, especially in the first 3 months. Some women are more nauseous than other women. Do you know that men are the reason why women are nauseous? There are certain genetic contributions that men make because of which women would be more nauseous. Now, there are women who have preeclampsia. That means their blood pressures would go up sky high during pregnancy. It is the men's genetic factors which contribute to the higher blood pressure that women have during pregnancy. Women have placental problems because of which maybe certain very serious complications can happen during pregnancy. One of them being restricted baby's growth. Again, would you know that it's the men's genetic factors which kind of contribute more to the placental formation and the insufficiency of it. So many such problems are being contributed from the men's side. Do you know that if the men were to be obese, they were to smoke, they were to have gestational diabetes or hypertension, that would contribute to the genetics of the baby in the womb, and that could lead to more complications during pregnancy? They can even lead to more complications for the child after it's born. So I saw a very nice video some time back which said that women put in their 9 months and put in their best during those 9 months to make sure that a healthy child is born. why shouldn't a man put in 9 months before conception to ensure that he's at his healthiest best? Quit smoking, quit drinking, make sure you eat healthy, make sure you take your vitamins and supplements and everything else to ensure that your child is not only safe during those 9 months, but for the entire lifetime after that child is born.
Wow, this is so eye-opening. The reason being is that, again, people mostly don't even know that men are the reason why so many issues might be happening. And also, you mentioned about the sperm tests. Most men probably wouldn't be doing the sperm test in the first place, so you don't even know that the problem is actually happening because of men.
So we do have couples even in today's day and age where when we ask these couples for tests, most men would point towards, I wouldn't say most men, a lot of men would point towards their women and say, "Acha, inke tests karwa lo." And when you've written down semen analysis, and in our books it's mentioned, always do the semen analysis first. So to be able to identify by a simple test whether the man is involved or not before you torture the woman with all, myriad of tests. Most women, when they come back with all the reports, would have all their investigations done and saying, अच्छा इन्होंने ना अभी टेस्ट नहीं करवाया, इन्होंने कहा पहले तुम अपने करवा लो, अगर प्रॉब्लम दिखेगा तो सोचेंगे बाद में, मेरा तो हो ही जाएगा, मेरे में कहाँ से दिक्कत आएगी. So I think that male chauvinistic attitude still exists in our society, and unfortunately the women have to bear the brunt of it.
So we discussed about preconception multivitamins and their importance in fertility, but what about protein supplements?
So every small thing contributes to fertility. कहते हैं ना बूंद बूंद से घड़ा भरता है. So there is going to be an importance of lifestyle changes, there is going to be an importance of preconception vitamins, and similarly there is a huge importance of proteins as well. Because what are proteins? Proteins are the building blocks of life. Every cell, every process, every tissue requires protein. So why should a healthy sperm not require protein? Why should a healthy egg not require protein? Why should the fertilization process or the process of embryo development not require protein? But I think the importance of understanding the importance of protein itself is taking a lot of time. So I remember a couple, they came in and the body mass index was slightly on the higher side for both partners, man and woman. And of course, they were having certain other habits. So I spent a lot of time discussing with them regarding the importance of exercise and their diet and weight loss and taking preconception vitamins, proteins, and quitting smoking and so on and so forth, along with their investigations that they need to do. They went out of my room, and when my counselor sat down with them, he said like, ये डॉक्टर साहब कहाँ चले गए, हम तो बच्चे करने आए थे और ये तो अलग ही लाइन में चले गए कि अब डाइट को लेके भी बात कर रहे हैं और ये तो पूरी चीज़ हमारे ऊपर डाल दी. You do need to meet your fertility specialist halfway. If you're going to expect your fertility specialist to do all the job for you, then your treatment becomes more complicated and much higher. So coming back to the importance of protein, there has to be adequate protein being taken on a daily basis, either through your diet or through your supplements, because if your daily protein requirement is not going to be made, then where is the cell division going to happen, and where is it going to happen in an efficient manner? And if the cell divisions and all the processes aren't going to happen in your body in the most methodical of manner, then all the other processes, including your fertility, is going to be affected.
I think that's such a great point. Usually when people think of protein, they usually think of just bodybuilding or building muscles. But there are so many different benefits of protein that so many people don't know of, including fertility. So that's great. So just jumping on to a different part of the podcast is you've mentioned the right age for fertility in one of your recent reels, and that reel really blew up. It had a lot of good reactions and a lot of bad reactions. So is there a right age for fertility?
So I think what I hadn't said in that viral reel, which I think I would want to make a correction and say right now, is honestly there is no right age. The couple between them have to decide whatever is right for them in terms of when are they mentally, physically, emotionally, financially ready to really have a child. No one, and definitely not a gynecologist or a fertility specialist, can tell them what is the right age to conceive. But if I were to speak only medically, we do know that fertility tends to decline after a certain age, more after the age of 30 and definitely after the age of 35. So this particular study that I had spoken about and quoted from Netherlands spoke about one such study which said that if you wish to conceive and if you wish to have maybe one child or two children or maybe even three, and depending on whether you're open to doing an IVF to conceive, if there are problems, or whether you purely want to conceive naturally, when is it that you should have your first child? And it said, that if you want to have maybe two children and you want to conceive naturally, then by the age of 27, you should probably have your first child. If you maybe are open to doing an IVF, then you could probably delay even up to the age of 30 years. This is just one such study which was quoted. But I think every couple needs to sit down between the two of them and also with their fertility specialist, get their basic evaluation done, and then plot from there as to what works best for them. If you go beyond 30, maybe if you go beyond 35, it's not that you can't conceive naturally, but your problems may be more. You would be requiring to be open to the use of certain fertility treatments if in case naturally it does not happen. I think that's the most important message that study was trying to put out and that I would like to put out to all the couples out there.
Thank you for clearing that out. So I can understand the frustration which somebody comes with actually, because if 27 is the ideal age according to science where people would want to have a child, by the time most people don't even find their partners, let alone getting married and let alone thinking of having a baby that time. But it seems like the fertility clock just runs in complete opposite to the career path or how people would want to plan, or when they would want to have a baby. So we've already spoken about people who want to have a child in the next 1.5 years. But if somebody does want to delay their pregnancy to maybe their mid-30s because of whatever reason they might have, family, career, etc., what options do they have in terms of treatment? Or
I think that's a brilliant question, and I do this day in and day out because thankfully more and more couples are now coming in for preconception counseling. Probably in the pre-COVID era, I would deal with maybe 2 couples in a month coming in for preconception counseling. Today, I have practically 1 couple walking in every single day for preconception counseling to my clinic. So there are 2 kinds of options open to them. So we do their basic evaluation, ovarian reserve testing, sperm quality and all the other things. And then we start calling them maybe every 6 months or every year, depending on their initial evaluation results. So say for example, a couple says, I do not wish to conceive in the next 3 years. And we know that decline in the ovarian reserve is most important. Then we start doing their ovarian reserve testing every 6 months to a year, plot it on a graph and see how it's changing. If over the next couple of years, we keep finding the values to be consistent, we keep giving them saying that, okay, you have 6 more months or you have 1 more year. But if at any point in time we find a dip starting to happen, we try and warn them saying that, look, the dip is happening. Maybe the dip is sharp, the dip is not so sharp, and you can start discussing as a couple between the two of you, when is it that you would want to start trying for a pregnancy? That's one way of looking at it. The other way is, if say the dip is actually happening and you're still not ready for a pregnancy, then you can actually get in for an IVF. The eggs are taken outside the body, the sperms are taken, the embryos are created and they are frozen in a very safe zone. Now time stands still for you because you can now choose, as you said, your career paths or have your personal agendas addressed, and you can come back at a later time. Take out those embryos which have been frozen at a time when you were still young, and those embryos can be used to give you a healthy pregnancy.
Wow, I think this has been so powerful. The information is so helpful for everyone who's thinking of planning for a pregnancy now or later. As we've discussed, for preconception multivitamins, for preconception counseling, is great for people who are planning for a pregnancy in the recent time, and for people who are planning for a pregnancy later on, it's embryo freezing for you. It gives you the freedom and the power to choose when to conceive. So I would like to thank Dr. Rajeev for giving out such amazing information which I feel is so relevant in today's time. according to the current lifestyle that we have, and to putting so much of knowledge in our basket, which I feel gives us the freedom which we've been looking for. Thank you, Dr. Rajeev, for coming on this podcast. It's been such a pleasure to have you, and the topics that we've discussed, these topics are so relevant today and so important for people to know. So please continue to give out such information on your reels. We all see it and we really all admire the work that you do. Thank you.
Thank you, Sahil, for having me on the show. And I think you're doing some amazing work out there by being a responsible brand owner, wherein you're not only doing what commercially you need to do, but also educating the masses, putting out so much of information. And I guess that is why you brought up this podcast. So all my best wishes to the wellness show, and for many more such podcasts and so much more information being put out through you and your future guests. Best of luck to you.
Thank you so much.